Lucy is my name. As you know, I work as a community stoma care nurse with Coloplast. The way it works at the moment is in the HSE, there's no HSE community stoma care nurse unless you live in Mullingar, Longford, or Cavan, or Monaghan. They're the only places in the country that they do have community stoma care nurses. So the way it works is the different stoma companies will employ us to go out and see people out in the community, because it's really, really important that people are seen at home as well, in their own homes. But if somebody isn't using Coloplast products, or if you're using a different company's products and they suit you and they work for you, that's absolutely fine. I don't just see people on Coloplast products. I see anybody who is on the right product for them, regardless of the company. So I do think that's always important for me to start off with as well. So I'm going to start sharing my slides, and what I want to talk to you about today is, let me know if you can't see this now. Can you see that?
No, it usually takes just a minute to kick in, so I'll let you know as soon as the slides start sharing. Now we have you.
You can see that there.
Yes.
That's not me in the picture. That's one of my colleagues, Trudy, over in the UK. But so really in this presentation, what I am hoping to go through is just giving you an understanding of how many people in the country have stomas, the different type of stomas that there is available, and then just picking up really hints and tips around cleaning, or especially in this time at the moment where you can't have somebody as easily coming out and measuring up your stoma, just about exactly how to make sure you have the right fit for your stoma as well. So I'll go through all those things, and if any questions pop up for you while I'm talking about a specific product or topic, please do let me know and I can answer your question then, or else you can hold off until the end and I'll also be able to answer any questions. So first of all, just I suppose, why do people have stomas? And there's such a wide variety of reasons. Probably at the moment, one of the most common reasons would be colorectal cancer. And that's often where somebody is picked up on a screening program, because Ireland does have a screening program now, a bowel screening program for over 65s, and that's picking up a lot more people. And they would have stomas for that, just often while they're going through their treatment, or for actually a part of the removal of the tumour, or the reason, or where the cancer is. Diverticulitis disease is another reason. Simply an obstruction somewhere in the bowel is a reason for somebody having a stoma. What's on the rise now, and especially with younger people, is ulcerative colitis and Crohn's. So I see a lot of older teens, young adults who now are getting stomas because they have Crohn's or colitis. And actually what I find a lot is that the reason why somebody gets their stoma plays a role in how they come to terms with their stoma. So for somebody, as I said, with cancer, who maybe it was picked up on a screening, they had absolutely no problems with their bowels or with their bladder, and now all of a sudden they have a stoma. It's very different to somebody with ulcerative colitis, or a reason that they're constantly not knowing needing to know where the toilet is, not being able to leave their house because they're afraid of incontinence. And that's often somebody like that, who stoma gives them a new lease of life, can accept it an awful lot easier than somebody who has absolutely no symptoms and then ends up having a stoma. Spina bifida is another very common reason for somebody having a stoma. Incontinence, I would see that quite a lot as well, and often for no particular reason, but they're suffering from incontinence. It could be after childbirth, it could be because they have a weakened sphincter. So that's one of the reasons why someone would have a stoma. A spinal cord injury or a trauma is another reason why I would come across people with stomas. And that could be an accident, a workplace accident, a car accident, a fall, or else a trauma, say, without resulting in a spinal cord injury, but with damage to their bowel. And again, that could be a workplace incident. I've had a few patients who have had a stoma as a result of a trauma to their bowels or to their bladder. And then another common thing that we're seeing, and hopefully down the line this is going to get less, but it's radiation damage as well. So somebody who may have had cancer 20 years ago and had radiation on that area, because now the radiation treatment is so direct and it's so good to pinpoint exactly where they need, the damage long term isn't, hopefully going forward won't be as bad. But sometimes now we see people who have had radiation 20 years ago and are now presenting with damage around their bowels. So hopefully down the line we're going to see less of that. So exactly what is a stoma? And a stoma actually comes from a Greek word which means an opening or a mouth. And that's exactly what a stoma is. When somebody has a stoma, there is absolutely nothing new in their body. The surgeon hasn't put in any new intervention. But what it means is they're after creating an opening somewhere in their abdomen to bring out part of their bowel or their bladder. And it's just a different way for to excrete either your stools or your urine. In medical terms, I suppose it's an artificial opening made somewhere into the body. And what happens with a stoma, it's where to form a stoma, the surgeon will divide surgically the bowels, and they'll either bring out one end or both ends. So sometimes you might come across a stoma nurse that comes and asks you, do you know if it's an end or a loop? So an end stoma is where they just bring out one part of the end part of the stoma. They've disconnected it from the rest of their bowel, and it's just one opening in it. Whereas you can also have a loop where they've brought out a loop of the bowel, they've just put a slit in half of it, and you've got two openings. Now, this one is often reversible. The loop is more easy for reversal. But as you can imagine, if you have two openings, sometimes the leaks can be harder to manage, but there's so many different products out there. There's always a solution to manage the leaks. And then also when it comes to an ileal conduit, which a lot of someone with bladder stomas would have, or urostomies, is where the surgeon is still actually using a part of the bowel. And what comes out is, you can see that the part of the bowel coming out, but it's actually diverted so that the urethra is coming through that. There's no stool contents coming through it. It's just, they've just used that part of your bowel so that there's a good area to get a good seal around the bag, but it's actually urine that comes through it. And I know that can sound confusing, and normally I'd have pictures and different things to show you, or I'd have different samples of stomas. So if you have any questions on that, please do come to me about it. Everyone's always surprised by this, the number of people in Ireland with a stoma, but I actually think that it's an awful lot more than 10,000 people. So in 2019 alone, there was 2,390 stomas formed in the country. And of those, there was only 260 reversals. So that's nearly 2,000 extra people that have stomas this year than they would have had the year before. And those numbers are similar. So I do think there's more than 10,000 people in the country with stomas. And it's really something that I think, because if you can carry on your normal day of life, or you should be able to with a stoma. So you could be in a shopping centre and I could pass you by, and if you have a stoma, I'd never know you have a stoma, or I would pass somebody else by that has a stoma, and you just don't know, because it's covered up. It shouldn't get in your way of quality of life. So you would be very surprised at the amount of people that actually do have stomas and you might not know. I would always say that if I'm in a stadium or a busy shopping centre, I would say you can be guaranteed that at least one person in that area will have a stoma.
Two questions have come in there just while you're talking about, while you mentioned reversal, and one is, there a time limit on being able to get a reversal, and then why are the rates so low? So there's two questions that came in while you mentioned reversal.
Really good question. No, there's no time limit on getting a reversal, but it really depends on the type of surgery that somebody has had. So what I would find that often is, if there's an obstruction somewhere, or if there is, or it's for cancer that they have to remove part of the tumour and they're allowing the bowel to rest, then they are more likely to get a reversal. or if it's done in an emergency or for trauma, sometimes they are more likely to get a reversal. The reasons why they're so low is because it has to be a certain type of surgery. There has to be enough bowel left to form a good patent movement or pathway for the stool to come out. So what a lot of people say, even they may have their stoma, and when they think of that, when it's reversed, it's not going to be the way it was beforehand. So a part of the bowel has been removed and they've rejoined it, but it's going to be a different type of stool movement and more increased movements. So a lot of people actually sometimes find that when they have their stoma, they can manage it. It gives them back their quality of life. They're in control of it rather than not knowing where the toilet is. So it can be a personal choice, and then a lot of it comes down to surgical as well. And that's why the reversal numbers are so low. Somebody with urostomy, really they don't have reversals on it. And it's because there's no way to form anything differently to come back into that the bladder. So for urostomy, in my 7 years have never seen a reversal of a urostomy, and so that's one of the reasons as well. So it completely depends on the type of stoma and the type of surgery that person has had. So I would say more people than 260 can have the reversals. You also have to as well consider that when somebody has the stoma, they're not considered, they're treated really. So whatever reason they've had it for, it's not considered an emergency or it's not considered high priority anymore. So with waiting lists and everything else, sometimes they do get bumped down. And the time limit on a reversal after surgery, we would say a minimum of 3 months. And we wouldn't like it to go anymore. If the option is there for reversal, the surgeons would aim to try and do it within the year, but that can vary as well. Does that answer your questions?
It seems to have. There's no further questions added onto that, so that's great. Thank you very much.
So the 3 main type of stomas. There's a colostomy, and this comes from your large bowel, your ileostomy, which comes from your small bowel, and then your urostomy. So you can see in that picture there with the urostomy, it actually looks very similar to the other 2 stomas, and that's because that's actually part of the bowel that they've just brought the urethra out through. There's also another type of stoma, which would be less common, but I definitely do come across it as well. They're called ureterostomies. And that's where the option may not be to form the ileoid conduit, which goes through the bowel. And it's the urethra has just come directly then up to the surface of the skin. That can be trickier to get a seal around, but it can be done as well. And there's always different products and different solutions out there. Rule of thumb, but this isn't always the case, but what normally happens is a colostomy would be on your left-hand side and the ileostomy and urostomy is on the right-hand side. That's rule of thumb, but that's not always the way it is. So you might find that you have one or the other and it's on the other side, and that's absolutely normal as well. So what should your stoma look like then? It's just to know if you ever are concerned about your stoma, what the type of things to look out for if you're noticing any change on your stoma. So a healthy stoma is pinkish and moist. It's normal to see some mucus on the stoma as well. And that's because our bowels and our kidneys will naturally produce a bit of mucus, and they can come out into the stoma bag. It's nothing to be concerned about. It's quite natural. Normally, when you're going to the toilet, you pass the mucus along with the stools or along with your urine, and you don't even notice it. So you might just be a little bit more noticeable now when you have a stoma. It's all connected the whole way down, so it should be the similar colour to the inside of your mouth, really. And you may often, when you're cleaning the stoma, notice a little bit of bleeding on the tissue. What I refer to this is contact bleeding. And I suppose because our bowels aren't used to being touched, when we're cleaning them, sometimes it's full of tiny little blood vessels, and we can just nick one of those little blood vessels and notice a little bit of bleeding on the cloth. And there is also no sensitive nerves in the stoma. So the stoma itself shouldn't be sore. If you're experiencing pain, it's really important to get in touch with your stomach care nurse, because often it can be a sign that there's something going on in the skin around it that's causing the pain. And that can be easily rectified as well. And your body does change over time. So it's important to realize that your stoma weight may well change as well. As we put on weight, as we lose weight, things can change. And the shape of the skin around it can change as well. So it's always no harm just to link in with a community stoma care nurse, just to have every so often have your stoma looked at and resized. A parastomal hernia is something that's really, really common with a stoma. What's actually happening is, as we discussed already, an incision is made into your abdominal muscle. And it reminds me of, if you have a top and a hole forms in it, all the material around that hole is a lot weaker. And your bowels, your muscles in your abdomen are very similar to that. So when the surgeon is making the incision in the muscle wall and bringing through that stoma, all those muscles are going to be a lot weaker. So it's important, if you can, to build back up with light little abdominal exercises. And I have some of them as well. If you want me to send on any of those exercises, you can start them at any stage. So no matter how long you have your stoma for, these are really light. They don't put any pressure on your tummy, but they will help to build back up your tummy muscles. And so what happens when you get a hernia is those weakened tummy muscles, our bowels and everything in behind them have quite a force on it, and they can just push through that weakened abdominal wall, and that's why you get a bulge around your stoma. Most hernias don't require surgery. There is the option to get surgery on it, but often it's not recommended because you're at higher risk of them coming back as well. So to reduce the risk of developing a parastomal hernia is to try and maintain good posture as well. When you're moving, if you're moving from a chair into the bed, make sure you have good support away, as well as using your abdominal muscles. Make sure that you have good support. And if you need any aids or anything, that you're using those as well. Avoiding any heavy lifting, so that's putting pressure onto your tummy muscles as well. There is support belts available, and actually in the last 6 months we're after getting 2 new support belts available on the medical card. Up until the beginning of this year there was only one product, it was an Ekin one, and it was good, but now we have 2 other options as well, and they come in different colours. So it's really good to have one of these belts, and I would actually recommend, with the Ekin you're entitled to 2 of them, but with these the 2 newer belts that are coming on stream, there's Vortex and Vanilla Blush, and you're entitled to 3 of them actually. So what they say is, have one for the washing machine, have one on, and have one in your drawer. And again, we can measure you up for those hernia support belts as well. The Vanilla Blush at the moment only comes in a 26-inch, so you need to be quite tall for that. But they are bringing them out in a 16-inch, which I think would be, or 16 centimeters, which will be really good as well if you have a smaller abdomen. And just, it's like everything as well, it's healthy eating, trying to avoid putting on a lot of weight, and try to keep moving as well. And if you feel you have put on weight, just trying to get into a healthy lifestyle as well. And then by taking regular exercise, and that can be swimming as well, is really, really good for our tummy muscles, because we're moving our abdominal, but the water will actually support our tummy muscles as well. So swimming is a really good one for getting regular exercise. I know I'm saying this in COVID when all the swimming pools are closed, but hopefully 2021, I'm feeling optimistic that we'll all be back swimming. Travel then, and sorry, just on that as well, if you have a stoma, it's no reason that you can't go swimming as well. All the bags should be waterproof. You can get extra tape around the sides of it as well, to reinforce it. So a stoma isn't a reason to stop you from swimming. And Vanilla Blush, the website that I talked about with the new hernia support belts, they have really good swimwear available as well. And what I also find is that Dunn's or Penny's, when you're going swimming, have really good swimwear that has, I think it's called a shapewear, but it has ruffled around the abdomen, around the tummy. I wear them, I find them absolutely brilliant, but they are really good then. The ruching around the abdominal area will not only support your tummy muscles, but it'll also make a little bit discreet if you are conscious of your stoma bag. So when you're traveling, the most important thing to know is that a stoma shouldn't prevent you from going traveling. But what's really important with it is, and it's like a lot of things, we need to plan ahead and be prepared. So take plenty of supplies with you, more than you would normally use, because it's like that. It's Murphy's Law. The one time that You just bring what you'd normally use at the one time that you need that extra few. So I would say even just bring double what you would normally use and you should be well covered. If you have travel insurance, just be sure to make sure that be sure to declare that you do have a stoma and that it's covered on it as well. If you are going on a flight, I would always say bring your stoma supplies in your carry-on, because it is known that the check-in stuff can go missing and you don't want to arrive there and all your stoma supplies have gone to a different country. So I would always say bring a week's supply in your carry-on, and then that will just give you that little bit of peace of mind as well. Bring your stoma product codes with you, but also just bring a description of the type of stoma that you have, of the type of bags that you use. So for example, if it's Coloplast, if it's a Coloplast product, if it's convexity or if it's flat, if it's drainable or if it is a tap or which you'd have for urostomy, or if it's closed, which you'd have for a colostomy, and then the cut that it's cut at as well. So because not all countries have the same type of products. And even just an example of that, when I started 7 years ago with Coloplast, we hadn't got anything new on the PCRS for years. So the UK had all these new and wonderful bags, and we still had the older bags. Thankfully, that's all changed now. They've opened up the PCRS, and we're really on par with the UK. But it is an example of where one country might have limited stock compared to somebody else. So if you have a good description of what you use, you should be able to get something that will match your needs. There's also travel certificates available as well. So if you're flying to another country, it will just explain when you're going through security or when you're going through anything, if they're asking about products or if you got caught and you have to be checked out, that you can just give them this. It's in all the different languages. I think there's Arabian there's anything that you can think of on it. And you can just give that to the person. It'll be signed by, I can sign it, or your GP can sign it. It'll have your details on it, and it just explains to them that you have a stoma. And you don't have to say it out loud either in front of if there's other people around. So it can be helpful like that as well. And then I said that about always carry your stoma supplies in your carry-on. And any of the spray, most of the sprays I'm aware of are less than 100 mils. If you're using a lubrication deodorant or something like that would have a higher one, I'd always just go into Pennies or Dunn's, grab the 50 mils travel containers and pour some into that, and then you can carry that on with you. And then keep hydrated. So especially if you're going to a warm climate. So if you have a urostomy, keep an eye on the colour of that. Make sure that you're getting plenty of fluids into you. If the sun is very warm, make sure with all the sweat that you're losing, fluids through, that you're getting it back into your body another way. So when it comes to diet, there's really no special diet with a stoma except for the first few weeks. Some foods may cause excessive wind. So if you have an ileostomy or you have a colostomy, there is some foods that we would recommend that you avoid if you are suffering from wind. So that could be cabbage or onions or examples of that. Chewing gum as well can cause you to swallow an awful lot more air as well, which can come into the bag. That shouldn't be a problem though if you have a urostomy. If it's urine that comes in, we don't have the same problem with wind. If you have an ileostomy, just remember that because it's from the small bowel, the pipework is smaller, so just chew well and take your time when you're eating. If you have an ileostomy as well, because we don't have our large bowel to reabsorb all the fluid, all the potassium, the water back into the body, we just need to keep an eye that we're not getting dehydrated and that we're replacing any salt that we're losing back into the bag. And I can go through all that in more detail as well with you if you have any questions at the end. And then with the urostomy, just make sure that you keep your fluid intake up. Very handy with a urostomy. It's very, very easy to see if there's a dramatic change in the colour of your urine, and that's a really good indication that you need to increase your fluids. And then also the amount of time you're changing it as well. If that alters, if you're emptying the bag less, that's an indication that you may need to keep an eye on your fluids as well. And if you have a colostomy, it's just important to realise that you can still suffer from constipation. So try and keep good fluid and fibre in your diet. And you may need a laxative as well with colostomy. So it's just important to realise that it depends on the type of stoma you have, what kind of things you need to keep in your mind. But there's no special diet. We all have foods that agree with us and don't agree with us, regardless of whether you have a stoma or not. So it's just keeping an eye on, if one day you have very watery output, just keep an eye on what you're after eating that day, and maybe the next time you eat a similar diet, just keep an eye on your output as well. If you do have very loose stool coming from an ileostomy, just if you want to thicken your output, bananas can be really good to thicken it. Cheese, white bread, marshmallows, white rice, and potatoes. And I know everyone always says when I pull out the marshmallows card there, it's an unusual one for a nurse to be recommending, but it does help to thicken the output, and it's the gelatin that's in that will help just thicken that output and keep it in the body for that little bit longer, so you're reabsorbing all the important nutrients back into the body. If you are suffering from constipation, then it's beans are good, cabbage, caffeine, green vegetables, spicy foods, melons, plenty of fiber really in your diet, regardless of whether you have a stoma or whether you have a stoma for a colostomy, or whether you don't, you have a urostomy, and you pass your bowels normal. It's important just to be aware of trying to keep your output nice and soft for when you're passing it in the toilet as well. If there's a lot of odor coming from it, apples can help, live yogurt, leafy vegetables, charcoal tablets can help as well. And actually, urostomy bags don't have a filter because we don't have to worry about air coming into the bag. But both the colostomy and the ileostomy have filters in it to allow air out, and those filters have charcoal in them, so it neutralizes any air that's leaving the bag. So if you do have a colostomy or an ileostomy, the only time you should notice an odor from that bag is when you're emptying it or changing it. If you're noticing an odor from the bag, just have a look at the way you're closing it, make sure it's closed properly. It should be 3 times towards you, and that's with most bags, regardless of what company makes them, because sometimes if it's not closed properly, a little bit of odor can get out, or else sometimes it's a sign that there's a leak somewhere. And while it might not be coming right out to the end that it's getting on your clothes, it's getting through there somewhere. So it could be a sign that you need to have a review at the bags you're using as well. And then foods to avoid, if you are finding that you're having a lot of wind into your stoma bag: beer, broccoli, cabbage, cauliflower, chewing gum, as I said already, and cucumbers, beans, onions. Fizzy drinks are really going to cause an awful lot of air in it, and spicy foods. And foods then, that are going to increase in odor as well, is asparagus, beans, beer, cabbage, cheese and eggs, fish, onions, stuffing, and I suppose it's the herbs in that as well, and herby food in general, and garlic. And it's just, as I've said already as well, we all react differently to different foods. So it's just to remember that no matter whether you have a stoma or not, we all react. Our bodies are all unique and they're all different. So I can have a list of everything, and there's probably one item, something else, that just one person can't have, and that's absolutely fine. It's trial and error in all of this. And that's not to say as well, if you do eat something and it causes it to be very loose, stop it for a few weeks, allow your bowels to readjust, and then you can try it again. It's not to say that if you have one bad episode at something, you have to cut it out. Just give it a break and then see how you get on a few weeks later. Sore skin then is probably one thing that when you're looking after your stoma yourself to be aware of. What can cause sore skin is ill-fitting bags, or not having the right bag for you. So body shape is going to play a part in that, and that's if you put on or lose weight as well. The folds in the skin are going to change around it, which can mean that the appliances no longer fits properly. There's some stool or urine getting out onto the skin, and that's going to cause it to be irritated. Incorrect measurement of stoma as well is if, say, for example, the stoma is cut too big, any of that exposed area, either your stool or urine is going to be sitting on that, and it's going to cause irritation. So just ensure that the template matches the stoma. Sensitivity to products as well can develop over time. So you may have been using a stoma bag for 20 years and then all of a sudden you get a reaction to it. And that can happen. So it's just important to speak with your stoma care nurse if you find that you are getting sensitive to the products. A good indication that that is the case is that when you take off the bag, the irritation is exactly the same shape as the bag. Or say you've been using a ring, the irritation is the exact same shape as the ring as well. So they're often indications that you're actually developing sensitivity to that product. And if that is the case, as I said, there's so many other products available out there. So it's just important to speak to your stoma care nurse as well. Not using adhesive spray remover. And I suppose where I often see is if you have your stoma for more than 15 years and it hasn't been reviewed. There was no such thing as a stoma care, as an adhesive spray remover back then. So often people don't even know that there is adhesive spray removers available out there. But there are, and they're absolutely brilliant to protect your skin. If you're taking off adhesive 2 to 3 times a week, or with a colostomy, you could be changing that bag 3 times a day. Making sure that you protect that skin with a really good adhesive spray remover that'll take all the friction away is really important as well. And we can send you out samples of those if you don't use it at the moment. Dry skin as well, that can break down easily. And what I found is that some people, when they get dry skin, they use the over-the-counter products that actually aren't suitable for under the stoma bag. So you might have skin soreness and somebody could recommend even Cavalon cream. That can build up under the bag because it's brilliant, but it's not designed for under stoma bags. So it can build up under the stoma bag and it can also stop the adhesive from sticking. If you do have dry skin, there is creams available that's specifically for under stoma bags, and we can send them out to you. If you are using it, less is more when you're going to be putting something moist onto the skin because you want it to dry into the skin. If after a few minutes it's still a bit wet, I'd wipe it off because at that stage the skin has absorbed as much as it can absorb, and then you can put the bag on. Incorrect pouch due to change in the body. So we may need to change the bag that you're using. And that's maybe even you might be on a flat bag and you just need to move over to a convexity bag. It's a very simple change, but it can make a big difference to your skin. And then loose output as well can cause your skin to be quite sore because often it's more acidy and it can get in under and deteriorate the adhesive that little bit easier. And it's going to really, really damage your skin. So just as long as monitoring your skin, if you do have loose output, it's just monitoring for signs of dehydration as well. And you can take Imodium or Diorolite as well, which will help manage that. So measuring your stoma, and this, I suppose in COVID times, it's really good just to, if you're concerned, oh, I'm not sure if this is fitting right, you can absolutely give one of myself or one of my colleagues, there's your own stoma care nurse a call. But in the meantime, it's good just to know exactly how well your bag should be fitting. So you can see the first diagram here where the skin exposed around it. That's not going to be a good fit. That skin is going to be exposed to whatever output is coming out from the stoma, and it's going to get sore. The bag beside it, it's just sitting nicely around the stoma, but there's no skin exposed. So that's the type that we should be expecting. And then you can see here 2 different fitting bags as well. Again, similar, one has skin exposed, the other sits nice and snugly around it. And there is really good scissors as well that we can get you if you want them. Because a big scissors, it's very hard to put these bags. Whereas if you have the right one, it makes it so much easier. And they have a round tip on the top of it as well, so you don't have to worry of puncturing through into the bag. And there is a little video that you can watch in your own time. I can send on to you if you'd like to watch that. Showering or swimming with a stoma. So I did talk about showering or swimming with your stoma. There's a good YouTube video as well that I can send on to you. So some people prefer to cover their stoma, so you can put a shower bag or a bag onto it so it doesn't get wet. The new Sentura Mio, I'm not sure if you're familiar with it or not, but that actually has a water repellent coating on it. So even though it's fabric that's on it, it won't hold on to the urine. So you can wipe that down and dry it the same way as you would to your skin, and it doesn't stay wet. I know I've had some people that have to get a hairdryer at their bag afterwards, because it's whether you like to shower with your stoma bag on or off is completely up to you. Some people prefer to take it off, some people prefer to leave it on, and that's completely up to you whether you do or not. If you feel that you'd like some extra, there is extra elastic tape that you can put around the sides that'll just reinforce it. If you like to shower with it on and it doesn't need to be changed, might just put on a little bit of extra tape on either side just to reinforce it. And then, as I've already said, swimming is a great way to get some gentle exercise. And then there's loads of different products available. You have women, there's high-waisted bikinis, there's swimwear with the ruffled panels, and then the pattern detail design as well can make them a lot more discreet. And men as well, you can get the high-waisted lycra swimming shorts under your trunks, and some people find them very useful as well. Compass and Vanilla Blush are two websites in the UK. They're available here, and Vanilla Blush one, I actually have a 27% discount on anything you want to buy on that. As I've already said, recently they're after getting their level 3 hernia support belts available on the PCRS, so that doesn't have to be paid for. But there's really good vests on that website, and when you go onto it, all of the models that are on that, they all have stomas. So Nicola is the lady's name. She actually is a nurse from Dublin. She went over to the UK and had a stoma, and she still has it, but she's after developing this website now with really good underwear, really good discreet. You can get waistbands, lace waistbands as well that can just fit nicely around your stoma, and it's really good as well for intimate times. And gives you that little bit extra confidence if you want it. So if you do have a look on that and you want to buy any of them, let me know and I'll give you the 20% discount. The other thing that I'm only recently after finding this out as well, so every day is a school day, but if you do get their vests or if you get a hernia, the level 3 hernia support belt, what they suggest is put it on, see whereabouts it closes on you and where it's comfortable, take it off and then close it off, not on the body, on your body, and pull it up then over your legs and up around your waist. Or if it's a vest that you're putting on, pull it up around the legs and then put your arms in over it. Because what that will do then is it'll lift your tummy muscles and give you that extra bit of support, rather than when you put it on, just close it on you or put it on over your head, it can drag it down. So that's a tip I only picked up there a few weeks ago. So I'm always learning as well, and if you have any extra hints and tips to let me know, I can pass on to others, that'll be great as well. As I've said, there is so many different products out there available, and while the skin, when it gets bad, it can be really, really sore and really, really difficult. The good news is that while skin will deteriorate so quickly, once you get the right product or the supporting accessory that you need, it'll also heal very quickly as well. And that's one thing that's always reassures people. It can look really bad, and sometimes people fear that it's infected, but it's rare that it would be infected. It's normally just that there's some way that stool or urine is getting onto the skin, and once we solve that problem, the skin normally heals really quickly again after that. And then just reasons why to contact your stoma care nurse. For practical solutions such as alternative pouches and accessories, alternative ways of managing your stoma, there is irrigation there for stomas. What I will say about that is they're only that, again, like the reversal, where it's only certain types of stomas and certain types of surgeries that will suit. It's the same with irrigation. So you can always talk to me if you have any questions on it, and I can let you know if it's something that I think would be suitable for not or not. And then if you've ever concerns about your stool consistency, if all of a sudden it's after changing, or you want to talk, you feel that you're getting a bit constipated, you can talk to me and I can give you some hints and tips, or any of the your local stoma care nurses. We'll also measure you up for the hernia support belts, and the good news is that I have 3 options now to pick from, as before I only had the one. If you have any lifestyle advice as well, or if you are planning on going traveling or you're doing something new, we can offer support and advice on that. We can also provide information and support as well. And what's really important for me is that your dignity and privacy is maintained throughout it all as well. And we are changing now to more virtual consultations as well. But it's really important that if we do those virtual consultations, that your dignity and privacy is completely upheld throughout it all. And we have done pilot studies over in the UK that would show that patients are very happy when they have with these, that we are maintaining our privacy and dignity with it as well. And I can also, or any community stoma care nurse can also call out to you at home as well. So I suppose for me, what my job as a stoma care nurse is to give you back control really of your stoma. And it's just to open up, for me, it's really, really important that to act as an advocate for people with stomas. Often in the past, we often like talking about our bowels or our bladder and having problems with them. But if our bowels or our bladder or our kidneys aren't working properly, then we're not working properly. So it's really, really important that we do open these conversations, and we're educating in pharmacies as well. So pharmacists are able to open these conversations as well, so that you have somebody to talk to. If you do ever have any concerns, you can call on somebody and just ask them. I mean, our bowels are as important as any other organ, same with our bladder and our kidneys as well. There is support out there as well. So there is the Ostomy Association of Ireland, and they send out newsletters every quarterly. There's also the Irish Association of Crohn's and Colitis, and then you have the Spina Bifida support group as well, which is brilliant. Lucy is my name, and that's my number on it. You also have your stoma care nurses in your hospital, and we are educating pharmacies and doing training and doing pharmacy clinics as well. So you can always ask your pharmacy, and normally they will have our details as well to pass on. The other thing that's really exciting, I suppose, from my point of view, is that there's a new program after being launched, and it's called Coloplast Care. So it just keeps you up to date on any new products that's coming on. It also, like I've said in the last clip, it's all about giving you back the power with your stoma as well. And this is another step towards empowering you to get useful tips for you that you don't, it can give you back control. You can ask, you can find out questions on it. They'll also let you know about any new products that are coming on stream, and you can decide if you feel that's suitable for you or not. And they'll also give you a say, so if I call out See It Today, it's no harm to get your stoma reviewed yearly, and it'll give you every year, they'll give you a little reminder about that as well. So if you would like to be signed up for that, again, you can always just drop me an email. My email address is, and I will pass it on to Katie at the end of this, but it's GB, Great Britain is, I suppose, GB, and then LOL, for lots of laughs, at Coloplast.com. It's my maiden name is O'Loughlin, so that's why it's LOL. That one used to be my initials. So it's GB LOL at Coloplast.com. And that's it. Any questions?
Now, there is a comment there that a food diary is a useful tool with colostomy.
Brilliant. Yeah.
Just one person passed it through. And there was another comment earlier that when you were talking about the hernia side of things, that those exercises would be really great if you could share those as well, please. And yeah. This is a question from me, and I didn't want to interrupt you too. I was just wondering if COVID-19 impacting on the number of operations that are performed, but that's my own kind of nosiness.
Yeah, I haven't noticed the difference the last few weeks. Actually, I've been busier than I have in a long time, so we were definitely a lot quieter with new patients in the first lockdown. But thankfully, this more recent lockdown, and I suppose that's why they did the lockdown earlier than we planned, was to keep the pressure off the hospital so they can continue to give people the surgeries that they need. So no, thankfully in this lockdown, I haven't noticed any difference. And I know from talking to some friends that are working in the hospitals, they've been very busy since COVID, since the first lockdown, trying to make up for that. So we only have that 2,390 was from 2019. So it's really only when we get the figures for next year that we'll know if it did impact it or not. But I'm hoping not as much as I originally feared during the first lockdown.
And then another question came in here is actually two. The first one, would you have any advice for a person with both ileostomy and colostomy in situ? A
urostomy and a colostomy, or an ileostomy and a colostomy.
Ileostomy and colostomy is what we're saying here.
I suppose with an ileostomy and colostomy, normally the colostomy would have very little coming out of it except for maybe some mucus. So there might be a mini cap that could be put onto the colostomy, which would free up some space. And they're very, very small little bags. And then you would just treat your colostomy as normal. So that's something that I would be very happy to talk to somebody about in more detail, so that I could just get a better understanding of exactly what their needs are and how I can help.
Perfect. And another one came in as well. Have you heard of stoma dilation and the benefits? Is it good or it's bad?
Yeah, stoma dilation is quite common as well. It's when stoma dilation is done when the stoma is quite small. So it's just to keep the I was going to say airway, but the pathway open. If it's needed, it's really, really successful, and it keeps either it could be for urethrostomy, which is what we do the dilation for sometimes, because the opening can be so small. Just make sure that keeps open. Or else sometimes with a stoma, the stoma can actually get so small that it needs to be kept open with dilation. So it's not everybody needs to do it, but when it's necessary, it works really, really well. And it just really, what you're doing by doing dilation is just keeping that pathway open so that the contents can still come out. So if you've been recommended to do dilation, I would absolutely advise you to keep doing it. But unless it's been advised, you may not need to do it. It's only, again, and that's where with stomas, they're so unique. It's tailored towards every individual. So if it's been something that's recommended for you, absolutely, it's a great way to keep your stoma open.
Perfect. And for the individual who asked about the ileostomy and colostomy, they said, thank you very much for the offer, and they may follow up with you now that they have your contact details. Then one other comment came in, I presume this is in relation to the dilation, that doing it every 6 months, long time ostomist. Yeah, sorry, I had to read the last one in case I had that wrong. So somebody there is doing it every 6 months. So they're a long time.
Yeah, and that's the routine that's working for them, and that's where some people need to do it every time that they would change the bag. So it just is completely tailored towards each individual need. And if your pathway, if your pathway really has been kept open with every 6 months, then that's absolutely fine.
Brilliant. And that's great. And thank yous came in there as well, that it was a brilliant seminar. So thank you very much for the feedback, everybody, and for the brilliant questions. And thank you very, very much, Lucy. That was very interesting. And I will share your information with everybody. And as I said, we have this recorded. So I'll be stopping the recording now, but just want to